Okay, so we are live. So welcome to our next Kid PT chat. And really the goal of these chats is to bring in different guest speakers to kind of talk about different topics related to physical therapy, but not necessarily, not exactly what we talk about during our sessions when we're focused on the kids. And a topic that comes up a lot because we have kind of that time to just talk about some of the different, concerns that parents have with the kids is that we often hear a lot of the problems that moms are having themselves. So when I met Dr. Claudia, I said this would be perfect to bring her in so we can talk about some of, the issues that come up with the moms. So Dr. Claudia, if you can introduce yourself and tell us a little bit about your background, that would be great.
Okay, thank you so much, Dr. Joni, for inviting me. I'm always extra excited when I speak on women's health topics, and this is a great opportunity, so I thank you for that. My background starts actually with pediatrics. So I was a teacher. My career started as an elementary school teacher. I taught for 2 years, and then I went back to school, and I wanted to pursue pediatrics. So I thought that was my passion. And then in school, going through the different rotations, I ended up in an integrated facility now, outpatient. So I received a doctorate in physical therapy, and I started my career in outpatient, mostly orthopedic. At the time, I was treating in a facility where we were integrated with nutrition, chiropractic, acupuncture, and other services. They were helping our patients from a myriad of different directions to recover. And I was noticing something that was really interesting at the time that intrigued me, that some of my patients that were seen by nutrition, for example, they were recovering faster. So wow, just seeing that the recovery time was decreased, and I was able to discharge these patients faster, or they were making their progressions faster, was something that started to really spark my interest. And this is when I went back to school to study functional medicine. So functional medicine is a complex way of looking at the body related to assessment, prevention, and also treating specific chronic conditions. And this has to do with lifestyle factors, nutrition, stress management, and so forth. Through my schooling in functional medicine, we started developing the women's health department in our facility. So I have been fortunate to start working with women. Our department started about, I think we started a couple of years ago, and has been developing since. And this work affords me amazing beauty every single day. So I'm absolutely, truly fascinated by doing this type of work. And we're integrating, women will come with all kinds of concerns, as you probably know, and you heard it. And now the biggest topic is hormones, right? Mm-hmm. Everyone, we see them on the schedule, they want to have a consult and discuss their hormones. And then, we find out that it's really some other problem that's driving some of these dysregulations, and then they are being seen by functional medicine doctor or a different practitioner that might address their concerns. But it's really, really a fun work and so rewarding.
So what are some of the complaints that someone will come in and that, they may say, something's going on with my hormones, I don't know what. Mm-hmm. What are some of the complaints you hear?
Usually emotional stuff, concerns with weight gain. That's definitely a big complaint the patient will come in for. Mood swings, anxiety, depression. Sometimes postpartum, we'll see these patients, or in preconception, having some of these complaints. And it's very interesting really understanding the underlying processes that drive some of these complaints. So when it comes to the topic of hormones, because this is definitely a hot topic today, we always laugh when we hear, oh, another patient is coming in with hormones complaints because they read somewhere an article and they think, this is what they are having. Really, hormones are just some proteins, molecules in the body that have to do with communication or achieve communication between different body systems or organs. So they are neurotransmitters. These molecules afford us to have this amazing choreographed communication between physiology and emotions, for example. Mm-hmm. However, they are heavily influenced by our lifestyle. So when someone experiences something they might think or describe as hormonal dysregulation, we need to understand or kind of drive back to where the problem started. Usually there is something that has been going on for a long time, some sort of decline in their physiology or in organs or systems that might have to do with some of the biggest problems that we're seeing with, for example, blood sugar dysregulation or gut gastrointestinal health. So when patients come in and sit with us, they'll find out that there is a lot of investigation that goes on. And then the hormonal problems or their symptoms are just the tail end of this big process that has happened or developed, or compensations they have developed over time.
So where do you start with a lot of these clients that are coming in with these complaints? It's such a complex system. Mm-hmm. And everything. So where do you even begin?
Yes. So that's actually what we were against a few years ago when we started this program, because we realized we had to have a system. So now we sort patients out. So I see them for a consult. So patients will come in and will just sit there for a half an hour for a consult. And we have a specific way of asking questions. And then we triaging them. Where are they going to go? For the most part, they will end up seeing the functional medicine physician. So we'll do a screening and we'll have them assess if I find that there's a lot of concerns that have to do with those biggest problems that we see, blood sugar dysregulation or gut health. Mm-hmm. Those usually will pop up for, I'm going to say, about 80% of the patients that present with those symptoms. So then I'll guide them through that department to fix those problems, right? Those are the biggest things and then we'll see how now the tail end of the problem, which is their so-called hormone problems, start, coming around. So that's one example. In other cases, if they come for difficulty conceiving or period dysregulations, there are other techniques that I will do myself with visceral manipulation to improve blood flow into the area, the lower pelvic organs, the abdominal organs, the GI tract, which are always so beneficial. And it always blows my mind of the power of the effect of these techniques. And I'm sure you, in your work, see some of these amazing benefits of these hands-on techniques with your patients as well.
Absolutely. We do a lot of manual therapy and hands-on work, and the more gentle, often the better, more powerful.
Yeah, absolutely. Yeah.
I thought it was really interesting when we met, we were speaking about some of the fertility work that you do. Mm-hmm. I had never heard of anything. I'd never heard of manual therapy for fertility issues. So it was kind of a mind-blowing thing for me, because that's like something there are more proactive things that you can do than I was even aware of. So I really would love to hear a little more about that.
Yes. So my quest for looking for a fertility, so to speak, treatment started about 5 years ago when my friend was trying to conceive and she was not successful. And she had gone through a series of procedures that kind of left her in a very bad place at that time. And I was determined to explore other ways to improve a woman's fertility, for example. That's all I knew at the time. Now I know that it's not a woman's fertility. We always have to work with couples. So it's a couple's fertility. But But just like the conventional system always looks at women, the woman has the procedure, she's always put on the spot. That's what I knew at the time. And at the time I watched a movie called Fertility, and I saw this amazing doctor doing these treatments. And I was looking at the statistics, and she was having 80% success when, I don't know if you know, IVF has 30% success. And I was determined to find this doctor and train with her. So that was Joni Mercier a year ago. I went and found her in Chicago and spent a week hands-on with her, learning these techniques that have to do with, some of it is manual therapy, some of it is charting, really teaching the woman how to understand her biomarkers. So fertility is described by several factors: healthy sperm, healthy egg, right? A womb or a uterus that is prepared, and timing. Right, so really understanding all these factors and teaching and walking along with my patients, which is the funnest thing. We call this the shared journey fertility treatment, right? So we have a year where I just walk along with my patients, observing these amazing changes that happen in their body as we're doing the treatment. And a year might seem like a long time, but you know that regardless in what century you live, if it's 21st century and you think everything is 5G, our body continues to heal at the same rate that healed, 500 years ago, and we cannot speed that up. I mean, we could with specific procedures, but what are the costs of doing so? And we're seeing more and more of those, so to speak, detrimental costs in some of these treatments. So the visceral manipulation in Mercier therapy has to do with hands-on manipulation, which is abdominal. So we don't go vaginal with this, which is nice. So abdominal work where we're assessing and sometimes even repositioning the uterus. There's more to it, it has to do with how, just like a joint would get stiff, right, in time if we didn't move it. Now we're trying to conceive later and later in life, right? Our body prepares by 13, right, to be able to conceive as soon as we have our period. So now we have careers or we're waiting longer. So sometimes that is a reason. And other times lifestyle factors such as inflammatory conditions, lifestyle stress management. This is why the approach has to be multifactorial. So if something has a multifactorial cause, right, more than one cause, the approach also has to be multifactorial as well. So restoring blood flow in that area, removing scar tissue if she had abdominal surgery or she had trauma, restoring the positioning of those organs. So therefore the physiology is appropriate. And then we are also working on decreasing toxicity. For example, a lot of women don't understand that there are factors in our home environment. There are hormone disruptors like plastics and BPA. So we're going through all that with these women, teaching them how to remove those hormone disruptors in their home, not only to improve their ability to conceive, but also once that baby comes, there's this good environment where they're not challenged.
Because that's something really for all of us that we need to try to cut down all those hormone dysregulators, all the things in our home. What would you say are kind of the biggest things and easiest to change too, that we could kind of get out of our homes?
Yes, so we do, I actually run a course on detoxification, and I spend about an hour and a half with patients that are really interested in making all the different changes and give them strategies. And but it's really not hard, and the information is out there. Some of the main classes, so to speak, are the cleaners that we're using in our homes, right? So we are at the time where we're really going nuts. There's this insanity about germs, and we end up really trading dirty for toxic, right? So we're going nuts, sanitizing and bleaching things, and even on baby toys. And the baby now, instead of eating bacteria that maybe the body would be able to handle it with maybe some diarrhea or maybe even vomiting, now they are going to eat Lysol and whatever other bleach where the body has no idea how to handle. And many times these toxins end up being stored in the brain, in the adipose tissues, creating some of these puzzling symptoms that our kids might have. Some of the most compelling cases that we had were where the child had severe asthma, and we worked with the parent in removing just the cleaners in the home, and there was other things that they did, but just the removing of the conventional cleaning products decreased their asthma by 70%.
Wow.
So that, that's a factor. Toxicity wise. And then we're looking at body care products, right? Lotions that we're using on our body, our hair, that have phthalates, something called phthalates, right? These molecules are hormone disruptors. I wanted to give you some stats on that. So the average American woman uses about 12 body care products. So her morning routine, so to speak, adds up to about 162 different chemicals just within that first hour. So I did a lecture at a company that makes these products. I don't know why they invited me to speak there, but they did. And they wanted me to speak on toxicity. And someone who was a biochemist stood up and said, yes, but these chemicals are in safe amounts in each of these products. So why are you so concerned with it? And I said, yes, you are absolutely correct. They are in safe amounts. However, now you're looking at a cocktail of safe amounts going, in the body. And that's just the first hour of the morning, right? So we really don't understand, like, something can be safe, but adding up a cocktail of, so to speak, safe levels, we're not quite sure what happens there. Actually, we are kind of sure. So Environmental Working Group, if you are familiar with them, this is a non-government organization. It's a bunch of scientists that got together and wanted to kind of look at some of these products because no one really is looking at them. There's no government regulation or anything like that bans any of these products. There are about 70,000 of them, and only 200 have been tested for safety.
Wow. What is that organization?
Environmental Working Group. So EWG.org. It's a great
I'm going to put in the comments. So if anyone wants to check it out, EWG.org.
Yep. Yeah, so that's one of my biggest resources when it comes to discussing toxicity. They have a large database where I will guide my patients to go. One of their databases has to do just with body care products. So it's called Skin Deep. So they will actually have specific companies that they allow them to test their products. And then they'll be scored on toxicity. I believe it's like 0 to 5 or something like that. And they'll even go on putting out specific elements that are considered carcinogens or reactive for asthma or autoimmunity. So a lot of their studies are obviously animal studies, but some of these elements have been studied already. Most of the studies are on rats, and some of the effects are absolutely mind-blowing.
Wow.
Looking at these elements being carcinogens. Yeah, so there we're seeing male factor when we're looking at fertility has to do with the male component in fertility, and we're seeing more and more of that. So we cannot really take the man out of the couple when we're talking about fertility. Just to give you some numbers, when we're looking compared to 20 years ago, the sperm count, for example, was considered normal, 65 million. Now 5 million is considered normal because the numbers have dropped so significantly that no one is normal anymore. So we had to actually drop these ranges. Yes, absolutely. And then we're looking at other concerns with these hormone disruptors that are not only in these products in our home, but also in our water. So another good thing to do is to go on EWG and put your zip code, and they will tell you exactly what's in your water. And then you can go and buy a filter to filter that element. So that's a really helpful resource. I'll give that to my patients. So our water is a source of hormone disruptors as well. And then the foods that we eat.
Yeah. So
yes.
Do you recommend organic? Is there certain things that you suggest avoiding, or is there concern with wheat products?
Mm-hmm. Yes. So I recommend organic the best that the patient can. There is a list that I usually will give out with some of the foods that are okay to eat non-organic. They are not heavily sprayed.
Mm-hmm.
And then there's a list where I'll say you always have to eat this organic or just don't buy it. I encourage my patients to go to the store and look for things that are in season, because those are the things they're going to be able to afford. And it's comparing to 15 years ago where organic was a hippie thing in the corner of the grocery store. This is not a thing anymore. It's becoming more affordable. And if we navigate it wisely, we can do a pretty good job at eating that way. But there are some products that we don't necessarily have to buy organic.
Okay.
They are okay. Yeah.
So kind of unrelated to that topic, another thing that kind of comes up a lot that I feel like I've heard this from other moms. I've heard it, I feel like, from my mom's friends, something that people just joke about and people have no idea that physical therapy can actually help it, is incontinence in postpartum and many years after. So I'd love to hear a little bit from you about that, because people generally just don't know that there's something you can do beyond laugh about it and try to make the best of it.
Mm-hmm. We actually have a saying that we use in our practice. Just because it's common doesn't mean it's normal. And you are right. It's unbelievable. Once we started this component of our practice, how many women are suffering with these complaints and concerns. And they thought for the longest time, that this is something that was just part of normal, so to speak. So here's my ideal world. I would really love, in this ideal world, to teach the women in preconception, which I have the opportunity doing because we're running this program. So some women grab it and come and learn. To teach her in preconception, when she's preparing to conceive, what to do to then prevent, right? So the prevention, if you don't get it, is so much better than if you get it to treat it. This is what I'm really passionate about, prevention. So if in my ideal world, I see the woman in preconceptions, here are some things that I will teach her. Postural alignment. So whatever happens at the bottom of the trunk has to do with the alignment up, all the way up into the crown of the head and down, how we're positioning ourselves, how we're sitting, how we're standing, how we're lifting, coughing, sneezing, and so forth. Then I go about teaching her how to manipulate intra-abdominal pressure, because she doesn't understand that she can do that, right? If she coughs and the pressure goes down into her pelvic floor on top of the bladder, that's going to be a problem. But if I teach her how to manipulate that pressure and bring it up here where she coughs, right, utilizing specific muscle groups and specific techniques, then she will not get pressure on the bladder when she coughs, laughs, or lifts. So these are just some motor control techniques that she will learn on how to manipulate where that pressure goes by activating specific muscles. And then there comes the strengthening and relaxation techniques. So, we know that muscles contract and relax. These are the only two things they know to do. And many times they'll end up stuck in one of these. They're either too weak and too relaxed, and then we don't have enough support, or they become hypertonic or too tight. And then we're also seeing some concerns with increased frequency there, or even pain, and incontinence as well. So that has to be assessed. And those muscles now have to be rethought, utilizing the right motor control techniques to contract and to relax, to do those two things in that sequence with specific activities. Teaching correct breathing techniques. The top of the pelvic cavity is the diaphragm, the bottom is the pelvic floor. So the diaphragm and the pelvic floor is actually called the pelvic diaphragm, because it works in synergy with our breathing diaphragm. So teaching the patient to activate those two diaphragms in a correct sequence it's actually amazing to see how many women are have this aberrant movement. of the diaphragm and pelvic diaphragm. So these are just some tricks that I like to teach them before the problem starts to understand how to prevent, and then how to keep then the auxiliary muscles, abdominals, how to engage TVA, transversus abdominal muscles. This stabilizes the anterior wall of the abdomen, and then utilizing glutes and pelvic floor muscles and so forth. So it really is a fun program. We're having a lot of fun, and we're definitely laughing a lot doing these exercises. Yeah. But I really would love to see all the women right then and there before they conceived and teach them this, so then we don't have to see them later when they're in bigger trouble. If they waited, right, and now they have, let's say, diastasis, right, so they had anterior wall weakness because of the pregnancy, they will come along with some problems. We always call that diastasis always comes with a friend. It never comes alone. So we will come with incontinence is going to be that one friend that will come, because now the abdominal wall is weak. So then the intra-abdominal pressure cannot be controlled as well. So then we're starting again from the basics, teaching her how to activate those muscles and recreate that intra-abdominal pressure. That's really the fundamental concept when it comes to incontinence.
Yeah, I can only imagine if someone develops that awareness pre-conception, it would change everything of your awareness afterwards.
Yes, it's fun. Sometimes I'll end up seeing the women before. Other times I see them through. So we're running the programs through the pregnancy. So we work with their belly while they are pregnant and teaching them these techniques. And that makes them, that makes all the difference when they give birth, because now we're preparing those muscles to lengthen, to stretch, to be ready. But many times I didn't see them there, and I then see them after when they have that problem, and that's fine too. As you know, you'll pick up your patient wherever they are, you'll meet them there, and then you'll mold to their needs. And it's the outcomes are great, actually. The statistics that I keep throwing is 80% of women get better without surgical intervention.
Yeah, so in some other countries, they have routine postpartum care. I've even read routine physical therapy care postpartum. And here it's a big gap where not only is it not routine, but often women are just either they don't even tell their providers that it's going on, or if they do tell them, they're not told that there's something that can help.
Yes, no, I agree. Actually, a lot of our patients will come from their OBGYN, and I say, so what does your doctor think about it? She's like, I never shared this with her. Okay.
I know.
So yeah,
some of my colleagues that do women's health in other parts of the country, it often they find out because they're there for back pain or something else. And then it comes up, and then all of a sudden it's, oh, wait, there's a whole other piece happening.
Yeah, so the one important aspect when I see patients and we see patients with back pain in our clinic that are women, that's always something that we'll end up assessing, because why is that back pain there? How is the back exposed now? Once again, what is happening with that intra-abdominal pressure that is stressing the back? And that pelvic floor comes right there into that exam as a concern. If my patient is open and has back pain, I'm either thinking maybe she doesn't have pain or incontinence, but she's probably weak there. So the rehabilitation programs will absolutely include the pelvic floor component in the abdominal component in these patients. So there's no exception.
That's great.
Even if they don't have symptoms.
That's great.
We usually will find weakness there. Talking about that gap between the providers, it's just so unfortunate, because we could really help and support each other in these settings, between OBGYNs and us, really supporting these patients with our services. But another area where I have done some work, which is post-cancer, seeing patients post-mastectomies with these scars, they're restricting their shoulders or breathing, or they have neuropathic symptoms. They are never referred for scar work. It's absolutely amazing what happens, once we put our hands on these patients. It changes their lives. It's absolutely phenomenal. And they are not
unless they
referred.
seek it out, because I'm thinking my friend, one of my mentors, who she seeked it out, but it wasn't that she was referred for the scar work. She's a PT, and she knew she needed to find that help.
Yes. Or if they present with something that looks more musculoskeletal, like a frozen shoulder, then they'll say, okay, I'll go do some PT. But every woman or every person that had some sort of type of surgery, and I learned this with my hands-on Mercier therapy techniques, when there is a scar on the surface, especially in the abdominal area or the chest, there's going to be scarring underneath. And in the abdominal area, such as post C-section, the C-section procedure, I don't know if you've ever had one or knew someone or knew how the experience is. Most women don't even know what's done. They don't want to know. But I tell them, I say, you want to listen, you have to listen to this. I don't know. I know you don't want to hear it, but I want to tell you what was done. So then you understand some of these consequences. So during the C-section, the woman's uterus is actually taken out of her body and put on the table and washed with saline, right? So just like if you cut an apple in half and you have oxidation happening, these organs that live inside the body, they cannot be exposed to oxygen for long periods of time. So you have these oxidation processes happening, and then you plug it back in and you sew it, and it's all good and ready to go. And a lot of these patients will then experience symptoms like gastric, like IBS. Bowel and bladder, because now they develop a ton of scar around their bowel where the surgery. So underneath, sometimes there's this matrix of scar tissue that develops around the bowel. So they'll find themselves with, the type of, IBS, constipation, type of symptoms or discomfort, fullness in the abdominal area, and they don't even think it's related to anything that went on with surgery. So then again, in my ideal world, I would love to see these women post C-section and do some visceral manipulation and scar work to soften their scar, and then monitor those gastrointestinal symptoms and making sure that she's not inflamed, that she's able to have good physiology in that region.
Yeah, it's new to me. It's so common that women have C-sections, but it's a traumatic thing to the body.
Yes, absolutely. Like any invasive surgery, but because we're women and we can take a lot, and then we jump straight into caregiving, and this is why women's health topics are always exciting me, because I like to use the opportunity every time I talk to women to let them know that just because they are caregivers, they cannot be second, they cannot be third, they must be first. If your cup is not filled, you cannot give. You have to cherish yourself first, and then helping others is inevitable, right? You will just come.
And that's what we always tell our moms. We always tell them, like, I know you're focused on your child, but if you're not taking care of yourself, how are you fully taking care of your child? It's so
so that is there's absolutely not possible. And whoever says, I put myself, and here's another thing where we can it's one of the most profound ways we can teach our children to value themselves, because they, as our children learn by observing, not by the words we are speaking to them. And if your presence is about sidestepping yourself every single day, that's what they learn. They learn that there's no value in self-care. And this is what they are going to be doing as adults as well. Empowering and empowering our child to find their essence. We have to find our own first. And they will soak in our presence. And they'll imitate the way we relate to ourselves and to life, and the way we to our environment. So that this is why self-care is the first thing that we have to do, especially if we're raising children or we are caregivers for others.
Can you just like put that on a billboard? So every woman that passes it sees it. It's so true.
And another thing that happens, Doc, is that women will hear this and be like, yes. And then they go home and it's like, wait, how do I do this thing?
Where
like,
do
what
I
am I supposed
start?
to do? Yeah, where do I start? What does this even mean? Or sometimes they'll get confused. And I always want to make sure that they understand what I'm saying. Okay, so I'm not saying that you should take your monthly income and go spend it on shoes at the mall. There's no self-care.
Yeah.
Okay, so or self-love. We always talk about self-love, and that's not what I mean, right? I really mean that we have to honor our body each and every single day on a daily basis through the foods we eat, the way we exercise, and the way we are at peace with how we look.
Yeah.
Okay. That's self-care. That's self-love, right? And this is what our children are going to observe.
And
this is how it's going to, yes, and imitate.
Yeah, that's huge. That's huge.
I usually when we talk about making a plan, because we like to be really practical, the first thing that I'll ask her is to set up a morning routine, something that is for her. And I really like the morning, even if she's not a morning person, because that's your first opportunity to show up for yourself, and to kind of plug in. And then from there you can give. And then she'll say, well, but I have 3 kids. I have to wake up and run and go. I don't even eat. And so I say, then just wake up 10 minutes early. You have to. If your spouse needed you to wake up to help them 10 minutes early, you would. If your child needed you, you would. But then for yourself, you wouldn't show up. So you need to show up for yourself. If you have 3 kids, you must wake up before they wake up. You must wake up and spend 10 minutes just soaking in there in your silence. Read, pray, meditate. Do something to fill yourself up first, and then show up for others. But we must show up for ourselves first.
That's really good advice and good practical advice. I started doing that myself. I don't know how long it's been now, but getting up early and just having that time to do some meditation, some yoga, some reading. I mean, reading a little, just having that time before anyone else is awake, and just time for me, and letting it evolve and grow, but just having the time dedicated.
Yes. And, it's nice things to say, but science shows us that people who do this are healthier, are happier, they live longer. So we don't need another study to tell us this, because people who are ignoring the other 1,000 are still going to ignore this one as well. But I find that when I'm in the setting with my patients, and we're in a setting, as you probably experience yourself, where the patient trusts you, and then they'll take that advice and you give them some practicality where, okay, I want you to do this. And patients come back, and I just had a patient today she had tears in her eyes. I said 10 minutes in the morning, and then at lunch I had to just do some reading for 2 minutes, and then 2 minutes in the afternoon, and her digestion completely changed, her mindset changed. She finally had a week where she was not anxious. And there are other interventions that we are doing with this patient. However, this was something that she felt helped her a lot, and it was right at her fingertips. She didn't spend any money for it. It's not expensive. It's right there. You don't have to go anywhere, just to be with yourself. And so powerful.
If you just stack those small habits, it can be really powerful.
Yes.
Yeah.
Yes. Most powerful things that we can do for ourselves, we already have them. Most of the answers to our most tormenting questions really are inside of us. And I think we are at the time where because of the information overload and internet and Google and all that, we're running around for external answers all the time, agitated with our head on fire. And for the most time, if we just cut ourselves away from this overload, we'll find that answer inside of us almost every single time. And this is one of my favorite things to guide my patient in that moment of silence in the morning. No phone, no TV, no noise. Just stay there and just soak up in that silence and go inward.
And it's hard to do that when you're so used to the constant digital.
Yes.
It's hard to break away from it and just stop and think. And just be.
Yes, but think about it, from the moment we wake up, we're bombarded. And how is our system handling this type of the stimulation overload? So when patients start taking time and practicing some of these techniques, they are blown away by how powerful they are and how much better they feel.
Yeah, that's just fantastic advice. Thank you so much. I will post in the comment section a link to your practice so people know where to find you and can see all the different services. I know that you do a lot of presentations. Is that on the website also, if you have upcoming ones?
Yes. We have several topics. I'm specifically presenting on detoxification, women's health. These are my two favorites, but we are presenting on a myriad of other conditions, and we actually have an upcoming in-house lecture on chronic disease prevention, management, and assessment, January 30th at 6:30. It's free. It's really a gift to our community, just like you are having these chats on just educating our patients to take the driver's seat when it comes to their health and start taking charge.
I'll post all that information on the comments so people know where to find your workshops and where to find you. And thank you so much. I really appreciate it. It was enlightening to me, and I'm sure to a lot of people as well.
Thank you, Dr. Joni. Thank you so much for inviting me.
Thank you.
It was a pleasure.